Hello and welcome to Homeopathy Simply Explained. I'm Petra Merker, a naturopath specializing in classical homeopathy from Darmstadt. In today's seminar, we'll talk about treatment examples for the use of remedies for ME/CFS. In this seminar part, we'll talk about wisdom teeth and a relapse in symptoms. ME/CFS patients can suffer from sensitivity to stimuli, which in some cases leads to complete isolation in a darkened room with headphones. This is very stressful for the entire family as it limits contact. In today's video, I explain how such symptoms can be controlled homeopathically. The topics of the seminar today: China officinale supplement, symptom relapse and homeopathic reorientation, Ptelea for nausea, Coffea cruda for noise sensitivity, Natrum muriaticum for light sensitivity, Dr. Herring's cases, Nux vomica for sensitivity to stimuli, Aethusa cynapium, and Arsenicum album for anxiety. Our daughter recently experienced a relapse of her symptoms. It got to the point where she had to lie in a darkened room with the door closed due to her sensitivity to light and noise. This was the point at which I had to switch her to homeopathic treatment. It took some time, however, until we discovered the cause of this decline. It all started with a change of riding stable. Up until this point, our daughter was able to ride on a lounge once a week for 20 minutes, which was a lot of fun for her and also stabilized her health. Since the journey to this riding stable was too far for us, we switched to a closer one. The stable owner had a pony group where the horses were cared for and ridden by a small group of children, and so she offered our daughter a visit. The whole thing was supposed to last 2 hours. Our daughter was enthusiastic and really wanted to take part, so we agreed to this experiment. We thought our daughter would be stable enough by now to be able to do this, as she had hiked with us almost every day for 4 hours with breaks during our autumn vacation. Our daughter had a lot of fun with the horses and also with the children. Unfortunately, the next day the PEM struck full force and our daughter suffered a deterioration in her health. As a result, she was no longer able to ride the following week. But because it was so important to her, we took her to the horses so she could at least pet them. Due to our daughter's school situation, we had requested a private tutor. We had to make an appointment with a very nice neuropsychologist who is familiar with ME/CFS patients. This appointment was very stressful for our daughter, and 2 days later we had our first appointment with a private tutor. Our daughter's health deteriorated further due to the exertion, so that she was no longer even able to pet the horses. The private tutor was very attentive to our daughter at the first appointment. At the second appointment, however, she tried to motivate her, which was completely overwhelming for our daughter. She went beyond her limits, which were a maximum of 10 minutes of lesson. To make matters worse, by now it was December 5th, 2024, she was also developing cold symptoms. It had been raining and our daughter's head got a little wet, which made her shiver. There were some strange symptoms again. The sore throat seemed to be coming from the back of her head, where she had an injury, which pressed and radiated into her throat. The old wounds in her lower jaw from her first dental surgery also seemed to be contributing to the sore throat. The sore throat was on the 9.5 scale, with 10 being the most severe. Added to this was a feverish feeling of illness. Nausea was also present. Holding her head still gave her a sense of security, as otherwise her head would have tilted due to the dizziness. Her head was hot and phlegm was running down her throat, causing the nausea. Speaking and moving worsened it. Her breathing felt hot, and the smell of food worsened the nausea. The nausea came in waves, sometimes more severe, sometimes less severe. Sounds and light also worsened the symptoms. So I recorded the symptoms. Here we see the repertorization. Since the nausea was predominant and very distressing, I took two modalities for this symptom: stomach nausea, worsening speech, and worsening movement. Another observed symptom was a red face. We see 5 remedies that cover all symptoms, and that's how I came across Ptelea trifoliata, which quickly brought improvement. On December 6, 2024, I gave our daughter Ptelea trifoliata, which we discussed in the first part, to strengthen her and combat the nausea. At that time, our daughter was still able to leave the house and was desperate to buy warmer riding breeches for when she could go horseback riding again. She went to 3 different shops with my husband. After just the first shop, she noticed she was feeling worse. But since she had Ptelea trifoliata with her, she boosted herself with it and went to the other 2 shops as well. That evening she told me what a tremendous improvement she had experienced with the Ptelea. The Ptelea significantly improved her sensory overload. For the first time, she was also able to describe her symptoms better, which had previously been too mentally demanding. She could now localize the exhaustion and felt it in the center of her head at the crown. Even after visiting the shops, she didn't feel overwhelmed for the first time. Her mind no longer felt so spaced out and foggy. Her thoughts were no longer so loose, they were more focused. She was also able to observe herself while thinking, which hadn't been possible before. Her thoughts had more structure. Her mind coped better with the weight of her hair when it was down. She also didn't need to eat as often. Her mind felt better in waves. Before, her head always felt unwell, but now it fluctuated between 1 and 10 on the scale. The fog in her brain was more disturbed over the entire area. All of her symptoms diminished and were now in waves. In the car, she had really noticed the traffic for the first time. The same thing happened during conversations. Previously, she was only aware of what was being said, but not the content of the conversation. It was easier for her to focus on the conversation. She could block out background noises more easily. Her lips were no longer chapped. She also began to process her experiences while sleeping. While walking, she was able to talk more, which means her multitasking improved, and her sensitivity to cold also returned. Thanks to the homeopathic remedy Ptelea trifoliata, our daughter's condition improved by 30%. However, the shopping trip led to a further deterioration of her health in the next day. The whole thing was incomprehensible to me, as our daughter, who had been so fit until then, continued to experience a deterioration in her health. I had given her Ptelea XM. I didn't have another potency at home at the time, and I didn't dare repeat this, as I still wasn't sure where this relapse was coming from. Later, I wanted to try Ptelea again in a lower potency. Going to pet the horses was out of the question. She could only take a short 10-minute walk around the house with us. Gradually, she became bedridden again. Now her wisdom teeth were also making themselves felt in the form of pain, or was that perhaps the cause of this enormous deterioration in her health? In any case, we were surprised that PEM could strike again like that and confine our daughter to bed again. Her legs were so weak, walking was almost impossible. The pain led to extreme sensitivity to sound and light, so our daughter had to lie in a quite darkened room before taking the new homeopathic remedies. Postural orthostatic tachycardia syndrome also worsened. Luckily, I still had some compression stockings at home from my pregnancy, which improved her by a full 3 points. Her appointment with the oral surgeon wasn't possible for another 2 weeks, and I had to somehow keep our daughter afloat until then. So I sat down and repertorized her symptoms, which we see here. We have the symptoms of difficult teething, radiating teeth pain, worsening headaches and noises, heat in the head, general warmth improving, cold headaches improving, cold applications improving headaches, and general standing worsening. There are 2 remedies that cover these symptoms. Our daughter was already taking arsenic album, but it didn't improve these symptoms. These symptoms are typical for Coffea cruda during teething, which is why I used Coffea for our daughter's symptoms. This remedy greatly reduced her sensitivity to noise. However, it also had no effect on her sensitivity to light, which is why I also started using the homeopathic remedy Natrum muriaticum. These 2 remedies together enabled our daughter to leave the dark room where no noise was allowed and to participate in life with us again. Let's now look at the homeopathic remedies Coffea cruda and Natrium muriaticum in relation to ME/CFS symptoms. Coffea causes extraordinary activity of body and mind. Patients who need this medicine are not in the mood to speak and only respond briefly. There is a fear of the slightest noise and great anxiety that cannot be calmed down. The mood fluctuates between joy and whining. We are dealing with complaints caused by joy, laughter, play, anger, shock, noises, or smells. That means illnesses following emotional excitement. The brain is overexcited, making the patient nervous and experiencing palpitations. All senses are heightened, even passive movements are perceived more acutely. There is dizziness with the feeling as if something is whirling around in the head. Consciousness can suddenly cease. Patients are sensitive to noise and music. Because of their chilliness, patients have a fear of fresh air, unlike those with Natrium muriaticum, who wants fresh air despite their chilliness. Movement and light also worsen the condition of Coffea patients. The eyes are often half open during sleep, as is typical in ME/CFS patients, and spasmodic eye movements may be present when awake. Coffea is often used for teething problems in children suffering from anemia or for stomach upsets in infants. Patients suffer from an abnormal feeling of hunger. Pain is intensely perceived, coupled with great anxiety and extreme excitability. Tight clothing is also not tolerated on the stomach. Patients are generally sensitive to touch. Emotionally, they may display excessive joy and enthusiasm, which is caused by hyperexcitability of the brain and nervous system. The sensory organs are also overexcited, which is why anything that can trigger strong excitement causes a deterioration. Patients constantly want to move and may feel as if something is about to burst inside their body. Children who need Coffea are irritable, weak, have frequent cramps, and are playful. They may also experience extreme restlessness and excitement with hysteria, including screaming and crying. Sudden emotional outbursts can cause fainting. There is great mental and physical exhaustion, which can lead to paralysis. They are easily startled when falling asleep, and their sleep is not deep. Upon waking, they may have clammy, sticky sweat on their hands and hot skin. In the drug picture of Natrium muriaticum, we find a weakness of memory or memory loss. Patients may be unconscious, absent-minded, or confused, and often suffer from homesickness. The mind is dull and thinking is difficult. There are constant thoughts that something might happen and an associated anxiety. The tendency to dwell on past sorrowful events is well known to us from Natrium muriaticum. Delirium with jerking of the body can also occur. Patients are taciturn and even words hurts them. They have an aversion to company and hate those who have offended them. In this stage, they become vindictive or shy of people. There is a tendency to cry or become agitated. Depression, worry, or hypochondriasis may also be present. Despite the brain fatigue, patients are sleepless. The speech organs are weak and speaking leads to exhaustion combined with a weak voice. Patients are jumpy, desperate, and hopeless. In Natrium muriaticum, the cause of the illness is fright, anger, annoyance, an insult, or suppressed resentment. There is a tiredness in the head with a feeling of emptiness. Patients experience worsening symptoms from eye strain, studying, light clothing pressure, and movement. Pressing pain in the forehead and eyeballs may be present. Sleep is not restful, and there may be complete insomnia, which makes the patient drowsy. Sleep is restless, the patient talks in his sleep, has anxious dreams, and cries. The face may appear either red or pale. Dr. Herring describes a case with chronic consequences following a head injury. I quote, "A blow to the forehead had dislodged the bone, and a small piece had flaked off. For 3 months thereafter he awoke every morning with a headache that lasted until 10 a.m., after which the scalp began to sweat and the headache passed. When he lay down at night, his head would begin to hurt. He heard a ringing and roaring noise until he fell asleep. Started up in alarm from his sleep, having dreamed of robbers, fire, murder, or other terrible things." End of quote. Here we see the categories for head injuries: pain after mechanical injuries to the head, improvement in perspiration, headaches at night, awaking due to shock and nightmares. And another case I continue to quote. "After a blow to the left parietal bone, a tender spot remained above the injury site. The slightest touch to this spot caused trembling throughout the body, pain day and night, with twitching of the limbs." End of quote. Here we have head injuries that worsen with touch, and again my daughter's familiar rubric of pain in old wounds. The scalp can be sensitive in Natrium muriaticum patients, and blindness due to nerve weakness can occur. Muscle weakness due to spinal cord irritation can also be present. Retinal images are retained for too long, resulting in extreme light sensitivity, accompanied by heaviness of the eyelids. Natrium muriaticum is known for its craving for salt, but mucus can also taste salty. We are dealing here with a tubercular or psychotic predisposition. Patients have a herpes infection, anemia, or even a threadworm infection. There is a loss of sensation or even seasickness. Both the trigeminal and glossopharyngeal nerves can be paralyzed. The muscle can be so weak that food takes the downward path. Exhaustion occurs due to lack of sleep. Chronic sore throat with swollen lymph nodes is present, and patients experience excessive hunger for snacks but feel tired after eating. There is sluggishness of the rectum and urination. Breathing is constricted and shortness of breath is present. The lungs have no room to expand, and there are stabbing pains in the cardiac region. Palpitations with shortness of breath from slight exertion may also be present. The neck is stiff, the spine tender, the back tired, and paralysis may occur due to spinal weakness. The arms then drop, becoming weak and heavy. The hands burn and sweat. The legs are also weak, heavy, stiff, painful, and trembling. There may be ankle pain due to weakness. Standing causes palpitations, fatigue, dizziness, and restlessness with chills. Patients move so much in their sleep that they often injure themselves. The eyes are half open and the skin is sensitive to touch. Due to nervous weakness, patients often drop objects. With Natrium muriaticum, we are again dealing with shock, namely shock from injury. Frequent yawning and stretching occur, and the patient often has to clear their throat. A lack of vital warmth with chills and coldness of the limbs, such as ice-cold hands and feet, but also blue lips and nails can be observed in the patient. Nevertheless, there is a desire for fresh air. If sweating occurs, it is under the armpits and on the soles of the feet. The weakness can also be associated with nausea and vomiting. The whole body can be affected by itching. Let's look at the repertorization that led me to this remedy and had an enormously positive effect on the light sensitivity. We see the categories chest pain, heart pulling, eye photophobia, eye pulling pain, mood, mental exhaustion, and breathing shortness of breath. We see Natrium muriaticum first, which was also used. Patients with ME/CFS have an increased craving for salt or are encouraged to consume more salt. In one of my videos, I reported on the problem with sodium salt and cellular metabolism in ME/CFS patients. The homeopathic remedy Natrium muriaticum, which is made from table salt, can help rebalance salt metabolism. In connection with sensitivity to irritants, I would like to discuss the drug picture of Nux vomica, which I mentioned in the last video. We have also used Nux vomica in conjunction with aconite for sensitivity to irritants. The homeopathic remedy Nux vomica contains the poisonous alkaloid strychnine in its starting substance, which is also present in the homeopathic remedy Nausea, which we will learn more about in another video. Strychnine, like caffeine, acts primarily in the spinal cord, occupies glycine receptors there, which inhibit the function of chloride channels. This leads to suppressive activity of the inhibitory neurons and thus to muscle tension or cramps, even to muscle damage. This can result in acute kidney failure, respiratory paralysis, overheating of the organism, and ultimately death. In the homeopathic drug picture related to ME/CFS symptoms, we find slowed thinking and confusion. The senses are sensitive to sounds, smell, and light. Symptoms occur after prolonged mental work. After a psychological shock, a tendency to sleep may be present. We may experience progressive paralysis and fainting, like dizziness may occur. Drowsiness and numbness in the head can be accompanied by loss of vision and hearing. Nux vomica also elevates symptoms of insomnia, which many ME/CFS patients suffer from. The headaches feel sore, as if the skull bones had been bruised. Accordingly, scalp is sensitive to touch. The pain can be so severe that the patient enters an almost delirious state. A feeling of heat in the cheeks with the rush of blood to the head and a feeling of coldness throughout the rest of the body can accompany the symptoms. Colds are triggered by wind and drafts. Nux vomica causes disturbance of the sympathetic nervous system with brain fatigue and even impending cerebral softening. Touching the feet, movement, or noise can trigger cramps. The headaches are dependent on mental work. We are dealing with atrophy at the optic nerve and paralysis of the third pair of cranial nerves, which controls the strained muscles of the eye and is also responsible for eye accommodation. Dilated pupils are also observed. The eyes hurt, the ears and nose itch, and the muscles of mastication are stiff and painful. the neck muscles are weak and sudden shocks to the brain can occur. Patients suddenly fall asleep for 1 or 2 minutes and fall down or are drowsy all day. There is weakness in the legs. Severe excitement with tremors can also occur. The motor nerve center is affected and the lower legs feel dead. Another homeopathic remedy I was using at this time was Aethusa cynapium. With this remedy, there is a feeling as if there is a blockage between the senses and external objects. These patients can also suffer from excruciating anxiety. With crying, dizziness and weakness are also part of the drug picture. Patients are sleepy during the day, cannot hold their head upright or sit down. Standing is also impossible due to weakness. There is sensitivity to light with blurred vision. A herpes infection may be present. Speech is sluggish and slow. The cervical lymph nodes are swollen and there is pain in the back of the head and neck. Sleep is restless with jerking. Patients may feel a weight on their chest. This remedy also causes discomfort during teething. When children become increasingly smaller, that means waste away. Gastrointestinal irritations can be pronounced. On an emotional level, Aethusa patients are solitary creatures and experience emotions very deeply, but do not share them. They love animals and have intense feeling like a child. The overloaded subconscious overwhelms patients before they fall asleep. Due to the loss of control and the fear of not waking up, there is a fear of falling asleep and also a fear of surgical procedures. Aethusa patients experience worsening symptoms due to emotional excitement and mental exertion. Patients are also very restless. The mind is numb so that no information can be absorbed. Patients are extremely tired and exhausted and suffered from headaches and insomnia. The organism has resigned itself. Professor Vitulkas writes in his Materia Medica Viva that Aethusa can lead to success when Picricum acidum would actually be indicated. We will discuss Picricum acidum in one of the next videos. Let's now take a closer look at the active ingredient Aethusine to gain a deeper understanding of the homeopathic remedy Aethusa cynapium. Aethusine is a central acting antispasmodic. It attacks the medulla oblongata, specifically the vascular and respiratory center. This causes ascending paralysis. The medulla oblongata is located in the brainstem and houses the respiratory, circulatory and vomiting center. It is also the relay point for the sensory fibers from the spinal cord and contains the pyramidal junction. A disturbance in this area can lead to paralysis or disturbance in sensitivity, speech, balance, consciousness, and vision, including double vision. The homeopathic remedy Aethusa helped our daughters sleep better and gain a little more energy. In the meantime, I repeatedly tried to return to a single remedy therapy, but found that this wasn't possible because the symptoms were still too complex. So at this point, our daughter was still taking several homeopathic remedies at once. Arsenic for anxiety, Coffea cruda for her sensitivity to noise, Natrium muriaticum for her sensitivity to light, Helleborus for her head injury, opium for her parasympathetic nervous system, and due to her chilliness and anxiety in the evening she also needed arsenic, which we have already discussed. Here we briefly review the symptoms for anxiety, as the upcoming wisdom tooth surgery was causing her a lot of trouble. We have the categories anxiety with fear, chills caused by anxiety, worsening in the evening, and insomnia caused by anxiety. In the next part, I would like to discuss the topic of nicotinic receptors and possible homeopathic treatment approaches in more detail. I look forward to seeing you again then.